When starting the scan, have the patient open their mouth wide and breathe through their nose. Begin scanning from the posterior teeth, moving according to the shape of the arch. Pay attention to the movement distance of the scanner tip. When scanning the posterior section of the teeth, move to the lingual side and continue scanning. As you transition from the lingual side to the buccal side, you can use your hand to assist by pushing aside the buccal mucosa and pulling the lips. When scanning the anterior teeth, you can use a mouth mirror or your fingers to pull the upper lip to ensure smooth scanning. Return to the occlusal surface of the posterior teeth, then switch to the buccal side for scanning. After completing the upper jaw scan, use the remote control function to perform an initial review of the scan results. If any areas were missed, perform a supplementary scan. Use the buttons to switch modes and proceed with the lower jaw scan. Start from the occlusal surface of the posterior teeth and move according to the shape of the arch. When scanning the posterior section, transition to the lingual side, being careful to avoid the tongue. When starting the buccal side scan, begin from the occlusal surface and move forward. When scanning the anterior teeth, you may choose to use your fingers or a mouth mirror to pull down the lower lip while ensuring the patient's mouth is wide open. If wrist mobility is restricted, you can pause to adjust your grip way. Once the lower jaw scan is preliminarily completed, use the remote control function to conduct a second review. Use the buttons to switch to the occlusal mode and proceed with the occlusal scan. Before scanning the occlusion, carefully check the patient's occlusion condition. Have the patient open their mouth wide, place the scanner head on the buccal side, push aside the buccal mucosa, and then have the patient bite down firmly. Move the scanner in an S-shaped pattern over the patient's teeth, scanning the posterior teeth until the occlusal scan is complete. Repeat the same procedure on the patient's right occlusal surface to ensure a comprehensive occlusal scan. Upon completion, review the scanned occlusal surfaces.